everybody. This week we're going to talk about prevention and wellness, and this is actually going to carry us through um, as the topic for next week as well. So, as part of preparation and understanding this topic, I'd like you to read the article that is posted on Blackboard that's entitled Promoting Health and Wellness Implications for Physical Therapist Practice. The author is Janet Besner. So, how does health, wellness, prevention fit into our scope? What does our association have to say? Well, we can look toward some of the documents that we've been using all semester to help give us some guidance. We have our standards of ethical practice, and standard number 8 says that physical therapist assistants shall participate in efforts to meet the health needs of people locally, nationally, or globally. And one of the statements underneath that standard says that physical therapist assistants shall educate members of the public about the benefits of physical therapy. And so when we think about that broadly, we know what the benefits of physical therapy are, and I think we can interpret that to impact how we can impact the people that we encounter, whether they're a formal patient, somebody that we're working with in the community at some type of health event, and how physical therapy, physical activity can impact their health and wellness. Our value-based behavior speaks to that as well. We have the value-based behavior of social responsibility, which is the promotion of a mutual trust between the PTA as a member of the profession and the larger public that necessitates responding to societal needs for health and wellness. So we do this by promoting a healthy lifestyle, wellness, and injury prevention strategies in the community, serving the profession and the community, including activities occurring in conjunction with work or outside of work, like a community health fair, and advocating for changes in laws, regulations, standards, and guidelines that positively affect physical therapy patient-client services. I included that under social responsibility because when we're going to start talking about prevention and wellness, what we're going to find is that, unfortunately, the way that our medical model is structured here in the United States, it's not really structured toward that idea of prevention. So that's something that we really need to be lobbying for, to get away from just treating illness and disease and getting toward more that prevention and wellness. Because we do have a large amount of chronic diseases within this country that we could be positively impacting if our model would go more toward that prevention and wellness side of things. So the APTA has several statements out and position statements on this topic. So I wanted to go over that so that you know what your association is saying. The first is the association's role in advocacy for prevention, wellness, fitness, health promotion, and management of disease and disability. What it says is that the APTA advocates for prevention, wellness, fitness, health promotion, and management of disease and disability. Advocacy includes, but is not limited to, scientific, educational, regulatory, and legislative activities that promote regular physical activity and exercise to enhance health and prevent disease. It includes developing collaborative, interprofessional, and partnering relationships with healthcare and community organizations and individuals that advocate for prevention, wellness, fitness, health promotion, and management of disease and disability. Priorities for the association's advocacy include, but are not limited to, collaborative relationships that have the potential to advance the vision for the physical therapy profession and leverage efforts to develop and implement effective population health management strategies. Appropriate physical activity and exercise goals and objectives put forth by government and other nationally recognized agencies and organizations. Appropriate efforts that enhance community design to promote safe physical activity and active forms of transportation for individuals and populations of all ages and abilities. So what that's speaking to, it's not only important that we're advocating for increased physical activity, but people have to have the means to be able to do it. And part of that is making sure that they're going to have a safe environment to go out and perform those physical activities. Advocating for consumer recognition of the value of the physical therapist to provide services for prevention, wellness, fitness, and health promotion, and for management of disease and disability for all populations and conditions. Physical education, physical conditioning, and wellness instruction at all levels of education. Physical therapists making healthy personal lifestyle choices. The next position statement is on the physical therapist's role in prevention, wellness, fitness, health promotion, and management. So before was what the association should do. This talks about us as professionals and says that physical therapists play a unique role in society in prevention, wellness, fitness, health promotion, and management of disease and disability by serving as a dynamic bridge between health and health services delivery for individuals and populations. This means that although physical therapists are experts in rehabilitation and habilitation, they also have the expertise and the opportunity to help individuals and populations improve overall health and prevent the need for avoidable healthcare services. Physical therapist roles may include education, direct intervention, research, advocacy, and collaborative consultation. Those roles are essential to the profession's vision of transforming society by optimizing movement to improve the human experience. Physical therapists, like most health professionals, are educated to provide services in the health services delivery environment. Physical therapists are uniquely educated and trained to adapt healthcare recommendations to the community environment where individuals live, work, learn, and play. This knowledge and ability enables physical therapists to adapt medical recommendations to specific environments, to meaningfully interpret health recommendations, to help individuals modify their health behaviors, and to ensure clinical and community services are integrated, available, and mutually reinforcing. So, for their role in prevention, wellness, fitness, and health promotion, physical therapists integrate decision-making skills across all dimensions and contextual factors of the International Classification of Function. They incorporate medical and health history into a plan that includes data related to body functions and structures, activities and participation, and relevant personal and environmental factors. They integrate scientific principles of movement, function, and exercise progression to promote physical activity and improve health outcomes for individuals and populations. They incorporate concepts of prevention, wellness, fitness, and health promotion with every patient or client as appropriate. They integrate and interpret the elements of medical, bio, psychosocial, and health promotion models that allow them to monitor health status over time. They are part of a community-based integration team that is focused on healthy lifestyles, design and develop integrated clinical and community screening programs to prevent and manage disease and disability, and refer as appropriate as part of that team. They apply the best available evidence in selecting and prescribing exercise for individuals and planning physical activity and injury prevention programs. They use skills and behavior change to promote healthy lifestyles in individuals and communities. As part of a community-based integrated team, they adapt tasks and the environment to promote healthy behaviors and improved health outcomes. They adopt healthy lifestyle choices. For their role in management of disease and disability, physical therapists recognize the risk factors for and the course of chronic diseases and the potential impact on quality of life and activities and participation. They establish and facilitate collaborative, interprofessional, patient, and client-centric relationships that empower individuals and populations in self-management across the lifespan and through the health continuum with an emphasis on movement and function. They apply best available evidence in selecting, prescribing, and using intervention and measurement strategies to establish exercise prescription for individuals to help them prevent primary, secondary, and tertiary conditions or optimize functional mobility. They apply best available evidence in planning programs to educate populations to help them prevent primary, secondary, and tertiary conditions or restore functional mobility. They provide non-surgical and non-pharmacological services as a hallmark of physical therapist practice, and they predict and interpret health outcomes and functional needs where people live, work, learn, and play. For their role as a dynamic link between health and health services delivery, physical therapists apply their expertise in exercise and physical activity to adapt health recommendations for individuals and populations from clinical settings to the home and community. They function as a member of an interprofessional team of healthcare providers, wellness and fitness providers, community health workers, public health providers, and other diverse professionals to help individuals and populations reduce their disease risk and improve their health and quality of life. They communicate and collaborate with relevant health professionals to help individuals and populations receive appropriate health services. For their role as advocates of prevention, wellness, fitness, health promotion, and management of disease and disability, physical therapists support scientific, educational, legislative, and other policy initiatives that promote regular physical activity and exercise to enhance health and prevent disease. They advocate for physical education, physical conditioning, and wellness instruction at all levels of education. They advocate for community design that promotes opportunities for safe physical activity and active forms of transportation for individuals and populations of all ages and abilities. There is also a position statement on the role that physical therapy has with nutrition. We know that diet and nutrition are key components of many conditions managed by us. What's more, they can actually directly affect the recovery and function while they're under our plan of care. So it makes sense that we would be concerned with nutritional intake and eating, and it is part of our scope of practice. The APTA's position is that it is the role of the physical therapist to screen for and provide information on diet and nutritional issues to patients, clients, and the community within their scope of practice. However, because each state has its own jurisdictional scope of physical therapy practice, you need to check your state practice act, which may be silent on nutrition. If that's the case, PTs need to turn to state laws governing nutritional practice, which, like physical therapy practice acts, are adopted by each state. Some states don't allow any person to give nutrition advice other than a registered dietitian. Others allow any person to give nutrition advice, but only allow registered dietitian nutritionists to charge or bill. So you should check what any of those state law on nutrition say. And should check personal scope of practice. Some Q&As that are out on the APTA's website: is nutritional education a reimbursable physical therapist procedure? The answer is, if the information a physical therapist provides is substantial in content and time, falls within the patient's plan of care, and is documented, it is possible that nutrition education reasonably could be charged as patient education, for example, self-care. However, you need to check your state laws on nutrition and contact third-party payers. May a physical therapist advertise nutrition services or use the designation nutritionist? The answer is, unless you or someone on the staff is licensed or holds a certificate in diet nutrition and is covered by professional liability insurance, it would not be advisable to advertise services that you may not be eligible to deliver. May a physical therapist test for nutritional deficiencies or basic blood values? Only in states where you would have the legal jurisdiction to order labs would that be permissible. May a physical therapist provide nutritional consultation? If you're certified or licensed in nutrition and dietetics, the nutrition consultation may be within your scope. But for jurisdictional scope, again, you should look at your state practice act and the state laws regarding nutrition. And when should a physical therapist refer to a specialist? So that's a couple different things. A PT should refer out when the required education is beyond general information. So involves maybe very specific dietary guidelines because of a very specific disease process. So that's when we should refer back to the physician, refer to a dietitian, nutritionist, someone that can give those very, very specifics that patient would need. Finally, there's a position statement on health priorities for populations and individuals. The APTA states that the following population health priorities guide the APTA work in the areas of prevention, wellness, fitness, health promotion, and management of disease and disability. Physical therapists can positively impact these areas, and where opportunities exist, can improve the health status of populations and individuals. Physical therapists also can help prevent secondary health conditions commonly associated with many chronic diseases and disabilities. The population health priorities identified to most relate to physical therapist practice in primary and secondary prevention and in disease management are active living. Within active living, we know that physical inactivity is a risk factor that contributes to onset and progression of diseases and conditions in individuals of all ages, including diabetes, heart disease, pulmonary disease, obesity, metabolic syndrome, psychosocial health, stroke, certain cancers, and certain musculoskeletal conditions. Physical therapists have the unique opportunity within the following populations identified by the U.S. National Prevention Strategy: aging individuals and populations who are at risk for falls, individuals and populations of all ages with health disparities, individuals and populations of all ages with chronic conditions, disabilities, and diseases that impact their ability to remain independent and physically active. We have the health priority of injury prevention. We're able to reduce injury, improving physical and emotional health. Injury can be prevented by making homes, communities, schools, and work sites safer and by implementing community-based prevention policies and programs. We have unique opportunities in the following areas as identified by USNPS: fall prevention, workplace injury prevention, community-based injury prevention. Next priority would be secondary prevention and chronic disease and disability management. Reducing or preventing health conditions that accompany many chronic diseases and disabilities helps to improve physical and emotional health and optimize individuals' participation in society. Secondary conditions and their risk factors can be identified and ameliorated through screening and recognition. Priorities for physical therapists in secondary prevention and chronic diseases and disability management includes those that impair individuals' body functions or structure, that limit individuals' activities, that restrict an individual's participation in society, and that require modification of environmental factors to allow for full participation in society. Physical therapists provide education, behavioral strategies, patient advocacy, referral opportunities, and identification of supportive resources after screening for the following USNPS health priorities: stress management, smoking cessation, sleep health, nutrition optimization, weight management, alcohol moderation and substance-free living, violence-free living, and adherence to healthcare recommendations. So then we also want to know, what do the payers say? Well, we know that each of the Medicare administrative contractors develop their own local coverage determinations. This is what the local coverage determination from National Government Services, or NGS, says, and that dictates what we do in Wisconsin. It says that exercises to promote overall fitness, flexibility, endurance, and absence of a complicated patient condition, aerobic conditioning, or weight reduction are not covered. So this is for Medicare. Maintenance exercises to maintain range of motion and or strength may only be covered when all criteria for skilled maintenance therapy are met. In addition, exercises that do not require or no longer require the skilled assessment and intervention of a qualified professional, auxiliary personnel, are non-covered. Repetitive types of exercises often can be taught to the patient or caregiver as part of a self-management caregiver or nursing care program. So I want to take a minute to talk a little bit about maintenance. Several years ago, there was a settlement agreement, and everybody refers to it as the JIMO agreement. This was a class action lawsuit that was brought against the Centers for Medicare and Medicaid Services. And it didn't go to court, but there was a settlement agreement. And what that settlement agreement clarified is that Medicare programs have to cover skilled nursing and skilled therapy services under Medicare's skilled nursing, home health, and outpatient therapy benefits when a beneficiary needs skilled care in order to maintain function or to prevent or slow decline or deterioration. So essentially what it does is it revised what was considered to be an idea in the past that the patient had to make progress. So now what it does is it has a maintenance coverage standard for nursing and therapy. So skilled nursing services would be covered where such skilled nursing services are necessary to maintain the patient's current condition or prevent deterioration. Same thing for therapy. The key is that what you're doing in order to have to maintain that patient still has to meet the definition, though, of skill. So if they could do it on their own as a home program, then they need to do it on their own as a home program. This truly means that you, as the therapist or therapy assistant, there is a specific skill that you're offering and providing that they actually require and can't do on their own or with a caregiver or with nursing. Okay. So, what we saw after this came out actually was some changes to the benefit language, as well as several follow ups where they got brought back into court because they felt that CMS had not done a sufficient job in educating about this change. And so, most recently this fall, they had to add additional information to their website and put out further education, because what we were seeing happen in the industry is that therapy claims were still being denied because they were not going with the maintenance coverage standard when they were reviewing. They were denying based on lack of progress. So, what are maintenance services? Again, these are nursing or therapy services to maintain a patient's condition or to prevent or slow further deterioration. Even though no improvement is expected, there may be specific instances in a skilled nursing facility, home health, or outpatient setting where the skills of the qualified therapist, registered nurse, or when provided by regulation, an LPN, are required to perform nursing therapy maintenance services that would otherwise be considered unskilled because of the patient's special medical complications, or where the need for services is of such a complexity that the skills of such a practitioner are required. And this is just the language right out of the local coverage determination that does speak to this idea of maintenance. It does talk about the idea that you do need skill in order for it to be considered maintenance. It could be that it's because you need periodic reevaluations or reassessments. It could be that you're doing this program to set up a maintenance program that could be carried out by someone else. It could be that you step in at different intervals to update people's programs. So there's many different ways that somebody could be on actually a maintenance plan. So let's talk a little bit about prevention. From a physical therapy practice perspective, prevention activities are directed toward achieving and restoring optimal functional capacity, minimizing impairments, functional limitations, and disabilities, optimizing activities and participation, maintaining health, thereby preventing further deterioration or further illness, and creating appropriate environmental adaptations to enhance independent function. We have primary, secondary, and tertiary prevention. So, primary prevention is the prevention of disease in a susceptible or potentially susceptible population through specific measures such as general health promotions efforts. It aims to prevent the disease from occurring, reduces incidence and prevalence of a disease. Secondary prevention includes efforts to decrease the duration of the illness, severity of the disease, and sequela through early diagnosis and prompt intervention. So this means the disease has occurred, but the person hasn't really noticed that anything is wrong yet. Tertiary prevention is where efforts are to limit the degree of disability and promote rehabilitation and restoration of function in patients and clients with chronic and irreversible diseases. This is going to be where you're targeting the person who already has the symptoms, and our goals are to prevent damage and pain, slow down the disease, prevent the disease from causing other problems, give better care to people with the disease, and make people healthy again and able to do what they used to do. So let's switch over into wellness. Wellness is a multidimensional state of being describing the existence of positive health in an individual as exemplified by quality of life and a sense of well-being. So the dimensions that are having this interplay to define what is wellness and how may somebody be judging their quality of life are emotional, intellectual, physical, professional, vocational, occupational, social, spiritual, and environmental. And then there's this concept of population health. You hear this a lot now. This is where you look at the health outcome of individuals and how that compares to the distribution of such outcomes within a group. So population health is a product of determinants of health, including medical care, public health, genetics, behaviors, social factors, and environmental factors. So when we look at that idea of promoting health and wellness and how that what those implications are for physical therapy practice, we can look at several different areas where we can make a positive impact. The first is physical activity. But in order to make that impact, we have to have knowledge and skills. So in order to make a positive impact with now physical activity from a knowledge perspective, you need to understand the age and disease specific exercise prescriptions for lifestyle related conditions and have a working knowledge of physical activity guidelines. We needed to work on developing our skills as professionals to have the ability to ask the question, are you physically active? And provide guidance when the answer is no. Be able to have that skill where we're role modeling behavior. We have to have the skill to be able to screen for physical activity, the skill of being able to create that exercise prescription. Counseling skills. I've got a handout attached that you can look through that is related to motivational interviewing. And then time management, helping people realize how to manage their time to fit the physical activity in. The next area that we could impact positively is nutrition and weight management. So first of all, we need to have knowledge related to population-based nutrition trends and data. What are the overweight and obesity guidelines and basic nutritional information? Do we have the skills? Do we have the ability to ask questions like, do you eat, the recommended amount of servings of fruits and vegetables a day? Do you have the appropriate intake of water? Are we role modeling that behavior? Are we screening for malnutrition, undernutrition, and obesity? Are we doing the assessment of BMI? Again, counseling skills. And knowing when it's outside of our scope and we need to be referring to a nutrition specialist. The next area that we could have positive impact on is smoking cessation. There we need to have knowledge of smoking information and resources. We need to understand and be able to do the 5 A's and 5 R's. So the 5 A's are being able to ask about the use, provide advice, be able to assess a client's willingness to quit, be able to assist through referral or counseling, and be able to arrange for follow-up. And then they have put together some suggested guidelines for counseling for intervention. And that would be the 5 R's: relevance, risks, rewards, roadblocks, and repetitions. Relevance is exploring the ways in which quitting could be personally relevant. Risk is asking them to identify potential negative consequences or risks of the tobacco use. Rewards is asking them to identify the potential benefits or rewards of smoking cessation. Roadblocks is helping them to identify and ways to overcome barriers. And then repetition is using repetition at every patient or client visit by engaging the patient or client in additional conversation about quitting smoking. So the skills that you would need are the ability to ask questions. Do you smoke? And provide guidance when the answer is yes. Role modeling the behavior. Having the skill to be able to screen for tobacco use and desire to quit. Again, counseling skills, interprofessional collaboration, so sending someone to the appropriate professionals, and physical activity prescription that may assist. The next topic that we may be able to help with is sleep. Sleep hygiene is a huge topic right now, and definitely a topic, especially if you're working in an environment where you're maybe seeing people with some chronic disease, especially pain related. So with this, you would need to have knowledge around the etiology, pathophysiology, diagnosis, treatment, prevention, and public health burden of sleep loss and disorders, and knowledge of the recommended sleep habits and conditions that are conducive to sleep. Skill sets you would need: the ability to ask questions. Do you get 7 to 8 hours of sleep per night? Are you tired in the morning? Do you fall asleep quickly? Are you sleepy during the day? And provide guidance if the answers indicate poor sleep hygiene. Role modeling, screening for sleep disorders, ability to provide instructions about optimal sleep habits, ability to recognize a need to refer to another provider, and physical activity prescription that may help with sleep hygiene. And then finally, stress management. Here you need the knowledge to know the difference between positive and negative stress, the theory supporting relaxation techniques, role of physical activity in managing stress, and resilience theory. Skills, ability to ask questions, do you feel stressed, and provide guidance if the answer is yes. I would also say here, it's your ability to recognize when someone has stress and they don't realize it. They may answer no, especially in some of your chronic pain patients, headache patients. This is definitely an area where you want to develop the eye for looking at that, as well as some other things from an objective assessment perspective, feeling temperature of hands, assessing patients' vital signs, use of biofeedback to help you do that. So here, role modeling, again, screening for stress, ability to instruct in relaxation techniques such as deep breathing, hand warming, meditation, physical activity prescription, time management techniques, and ability to recognize the need to refer to another provider. So something that the APTA has been focused on here for a while is this concept of patients having an annual checkup with physical therapy. And I think it's a very interesting concept, especially as there's this movement knowing we actually have not enough primary care physicians in the United States, especially in some rural and underserved environments. And sometimes those underserved are not rural. That, I mean, Milwaukee's considered underserved when you look at some of the population and who actually has the ability to get into a primary care physician or has a primary care physician. And we know that we are, in physical therapy, we're the movement experts. So this idea of an annual checkup, I think, is a very interesting concept, because I think we could be having some very positive implications into people's lives and quality of life. So I gave you a copy of what the annual checkup form looks like. It doesn't have to be used that way. It's meant to be a guide. It could be something that's changed. But what you'll see in there is it looks at the, first of all, demographics, gets a very good medical history, looks at the disease risk profile, so physical activity, diet, smoking, alcohol use, BMI, emotional, hearing, integumentary, pain, vision, mental function, sensation, and vital signs. There's a big movement right now in the physical therapy world that's called the Vitals Are Vital movement. So if you've not taken a chance to look at that, I encourage you to do that. It really, those vital signs tell us a lot about what's going on with our patients. The annual checkup, though, then really goes in to look at physical performance. So what could we positively impact? So it looks at aerobic capacity, recommending the 6-minute walk. Looks at balance, static, doing single limb stance, and dynamic, doing hexagon agility for your younger patients. For your people over 30, it recommends the 4-square step. Looking at locomotion speed by using the 10-meter walk. Looking at mobility, flexibility, and functional strength by extensor endurance testing, 5 times sit to stand push-ups, grip testing, Amply Scratch, and the sit and reach test, doing a postural assessment, and then quality of movement. It doesn't give you a lot of guidance on quality of movement, so what I would recommend to you is, if you've never heard about it or him, there is a wonderful, wonderful website. It's graycook.com. Gray Cook is a physical therapist in West Virginia. He has several books out on functional movement. He does a lot with athletes, but I was always able to take his information and bring it down to the level of my everyday patient as well, because when you see what his functional mobility screen looks at, it's just your basic movement patterns that everyone needs to do on a day in, day out basis. And he really does sort of look at up above what they talked about with mobility, flexibility, and functional strength. When he does look at these qualities of movement, he's looking at, first of all, do you have the range of motion to be able to do it? Do you have the strength? And then do you have the actual coordinated movement pattern that is a correct pattern? And he actually has a very formal system of grading each of these things. And what he looks at is the deep squat, a hurdle step, an inline lunge, shoulder mobility, active straight leg raise, push-up, and rotary stability. He scores it a 3 if you can do the movement pattern perfectly. Score of a 2 means, yep, you did it, but there's definitely some room for improvement. A score of 1 means you just couldn't perform that movement pattern. And if you have pain at any point in any of the movement patterns, you're going to get a 0 for that movement pattern. So it's a very interesting mobility screen. Like I said, I've used it on every type of patient you can imagine. It really is a great thing, and I have a ton of information and videos if you guys would ever be interested. And like I said, he's got a great website, great blog, great information out there. He's usually at a large conference that occurs in the summer every year in Chicago that's put on by a company by the name of Perform Better. And definitely, if you ever get a chance to hear him speak in person, I would highly, highly recommend it. So, as we talked through all those things that we can impact, it talks about us needing to understand the physical activity guidelines. So, there are guidelines that have been put out there now on a national level. And it says to at least get just the important health benefits, adults need to at least do 2 hours and 30 minutes of moderate intensity aerobic activity every week and muscle strengthening activities on 2 or more days a week. Or they have to do an hour and 15 minutes of vigorous intensity exercise every week and muscle strengthening activities 2 or more days a week. Or an equivalent mix of moderate and vigorous intensity aerobic activity, and again, that muscle strengthening activity stays at 2 or more days a week. You can do 10 minutes at a time. It's fine. Your patient may say 150 minutes a week just sounds like too much. Talk to them about how they can sort of break that up into small chunks. If they want to get greater health benefits, then we're looking at 5 hours a week of moderate intensity aerobic activity. Again, the 2 or more days a week of the strength training, or 2 hours and 30 minutes of the vigorous aerobic activity. Muscle strengthening stays the same. And then the third option of an equivalent mix of moderate and vigorous aerobic with the muscle strengthening 2 or more days per week. So what counts as aerobic activity? It's something that gets you breathing harder, gets your heart beating faster. So you want to put this into the terms that the patient's going to understand. It could be anything from pushing your lawnmower, taking a dance class, biking to the store, many different types of activity. And again, they can break it up into 10-minute increments. The idea of intensity is letting them know it's that idea of how hard they feel their body is working. Okay. Light would be shopping, cooking, doing your laundry. Okay. That doesn't count toward the guidelines. All right. Moderate would be walking fast, water aerobics, riding a bike, doubles tennis, pushing a lawnmower. Vigorous would be jogging or running, swimming laps, riding a bike on hills or very fast, singles tennis, playing basketball. Again, working through them, figuring out how much they're going to do in a week. The rule of thumb is that 1 minute of vigorous is about the same as 2 minutes of moderate. So when they're figuring out that ratio. Okay. What counts for strength training? Again, you want to put this in terms of the people are going to understand. To gain health benefits, it needs to be done at a point where it's a little bit difficult for them, right? So the repetition is 1 complete movement of an activity, like a weight or doing a sit-up. They try to do 8 to 12 repetitions, okay? And work up to doing 2 to 3 sets. Again, they can do many different things. They can lift weights. They can work with resistance bands. They can do body weight training, heavy gardening, yoga, a lot of different options. This is a really great fact sheet if you would ever want to get to it. This was developed by the U.S. Department of Health and Human Services for their physical activity guidelines. It was felt that they're needed because of the importance of physical activity to the health of Americans whose current physical inactivity puts them at unnecessary risk. And they did it for adults, children, and adolescents. So for children and adolescents, they said that's ages 6 to 17. They should be having 60 minutes or more of physical activity every day. Most of the hour should be either moderate or vigorous. And as part of their daily physical activity, it should be vigorous intensity activity on at least 3 days per week. They also should do muscle strengthening and bone strengthening on at least 3 days per week. For adults between the ages of 18 and 64, they say on 2 or more days per week, we should have that level of exercise that we already talked about. And for people that are 65 years and older, they should follow the adult guidelines. It's not, something that they have to avoid because they're getting older. We know that they can benefit from that strength training, and we know that they can benefit from a balance perspective as well. So what we do know is that for adults and older adults, there's strong evidence that by meeting those physical activity guidelines, they lower the risk of early death, heart disease, stroke, type 2 diabetes, high blood pressure, adverse blood lipid profile, metabolic syndromes, and colon and breast cancers. There's strong evidence of a prevention of weight gain, strong evidence of weight loss when combined with diet, strong evidence of improved cardiorespiratory and muscular fitness, strong evidence of prevention of falls, reduced depression, and better cognitive function. There was a really great study a while back that looked at lower extremity power and cognition, and they did it with twins, which is what made it really interesting. And the twin that had the better lower extremity power actually had less of a cognitive decline. So another great study a while back, one that I'm always preaching a little bit out in our facilities where we work with older adults, it compared giving a home program of 50 sit to stands per day versus just a kind of a generalized lower extremity strength program with weights. And actually the patients that did better were the ones that did the 50 sit to stands a day. So think about that and how they could break that up throughout the day. I make my parents do it. I'm like, did you get your 50 in today? So that's just something to think about when you're working through these ideas of exercise prescription. Somebody that seems like they're a little bit adverse to having to do the weights or doing things, think about how you could just incorporate for them body weight activity, their normal functional activities throughout the day to meet some of those guidelines. With adults and older adults, there's moderate to strong evidence that the physical activity guidelines result in better functional health and reduce abdominal obesity. There's moderate evidence that there's weight maintenance after weight loss, lower risk of hip fracture, increased bone density, improved sleep quality, and lower risk of lung and endometrial cancers. For children and adolescents, by meeting those physical activity guidelines, there's strong evidence of improved cardiorespiratory endurance and muscular fitness, favorable body composition, improved bone health, improved cardiovascular and metabolic health biomarkers, and moderate evidence of reduced symptoms of anxiety and depression. So I think these physical activity guidelines are extremely, extremely important. We know that as a nation, we've got a high level of inactivity. We did a huge wellness campaign in our facilities. I guess it was probably 2 or 3 years ago, and it was all about getting people out of the wheelchair. Because what you'll see a lot of times in the nursing homes is, people pedaling through on their wheelchairs. And so we did a whole out of the wheelchair campaign. And what we did with that was, first of all, talked about the impact on health that sitting is causing, and we did it from head to toe. So every part of the body, every body system, and how it was impacting, as well as we talked about from a very low level patient to a very high level patient, what were all of the different things that we could do to impact those negative impacts of sitting. So when you really think about that, there's so many things that we were able to do. It was a really great campaign. I think it's one that we actually need to bring back again since we transitioned into this new company. But it was very, very well received, and it's something that nursing can get on board with. It was something activities could get on board with. We gave a lot of different ideas of how to bring that through the patient and the resident's entire day. With that annual sort of physical idea by the physical therapist, they did talk about having some conversations regarding nutrition and diet and BMI. One of the potential things that you may want to use is called the WAVE assessment that looks at weight, activity, variety, and excess. And so I just gave you copies of what that assessment is, and it talks through how to make recommendations. Another potential assessment you could use is called the REAP, which is the Rapid Eating Assessment for Patients. This is just a quick questionnaire that they fill out, and then it talks about some of the different counseling points. So, just again, a way for you to develop knowledge and skills related to these areas. And here is one other idea about starting the conversation, just a way to get people going, to start that conversation. Again, it's just a small little kind of survey that they fill in and you can have a discussion about. In that annual physical as well, there was the discussion regarding alcohol. So this is called the Audit C, and it looks at the potential for alcohol related disorders based on consumption. So a lot of different things you could really be impacting. You can have these impacts with your patients that are coming in where you're really seeing them for a tertiary reason, right? I'm actually seeing Mrs. Smith for a shoulder, but I'm going to bring in some of these wellness ideas. You could work in a space that really is embracing this idea of physical therapists as being potentially the primary person for looking at all of those function based skills. But then you could also potentially be participating in other types of community events. So I gave you a couple resources here. One was based off of a senior health fair that they did in Massachusetts that the Massachusetts Physical Therapy Association was involved with. And it talked about how they first of all got everything figured out about what they wanted to do. Their focus of the fair was balance and falls. And in order to do that, they decided what did they want to look at. So when the seniors would get there, they actually got a little scorecard, and that scorecard is what they would get filled in as they went through the fair and had the different testing done, as well as were collecting collateral information. So while they were there, they had their blood pressure tested, they did a chair stand test, they did a timed up and go, and they did a 4 square step. So would that be the test you absolutely want to do? Well, we can look back at what that annual physical is looking at, that is recommending as some of the tests. That may be something you would want to incorporate, but you always want to have collaterals as well. So could you have collaterals on those physical activity guidelines? Could you have collaterals, since they were really focusing on balance and falls, on what do you do in your home environment to decrease risk, right? What do you do with the throw rugs? What do you do about lighting? And then also always talking to them about what physical therapy does have to offer if they are noticing that they do have an issue.